Thank you for choosing Access On Demand. Access believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, everyone. This is Matt Abbott with Access Hospice. I am a RN on the hospice team here at Access, and you are logged in for the live training webinar on the hospice solution, going over agency setup, intake, and scheduling. So we have a lot to cover today, but by the end of our time together today, you should be able to successfully set up your agency, to customize it to your agency's workflow, as well as start to get some of your patients through the intake process and begin scheduling tasks for your team members to complete. Once you've completed your contract with Access, you will get a login email, a welcome email welcoming you to the solution. And there it's going to prompt you to set up your password for the application. So at Access, we have a single sign-on solution. So any other of the hospice, in addition to hospice rather, Access solutions that you have signed up for, you will be able to see when you log in for the first time to Access. You will land on the screen that you should be seeing right now, and this is what we call our Access Planner. And here is a whole bunch of information about what's going on for you specifically as a clinician. We also have links in the Access Planner to training and education. One of the things that we pride ourselves on at Access is being well connected within the industry and being thought leaders and trying to lead not only from a technology perspective, but also make sure that we can inform you as our clients and partners with what's going on in the industry, how that's impacting your day-to-day workflow, and putting all that information inside of our solutions so that you have access to it as part of your day-to-day workflow. From the Access Planner on the left-hand side of the screen, we're going to select the hospice platform because that is what we are getting set up during today's webinar. When you log into the hospice solution, you are going to be taken to My Dashboard. My Dashboard has been customized so that every tile is meaningful for someone at the agency. First, as I mentioned, our thought leadership is on display here already with videos about what's going on at Access and what's going on in the industry, as well as news and updates. This updates live to our blog posts about, again, industry happenings, hot topics in the industry, and regulatory changes that are going to be affecting your day-to-day work. The rest of the tiles of course, will help drive your workflow as you get the solution set up. Before we take a little tour of how to navigate the solution, I want to show you one thing here at the top. You'll see your name when you've logged in. I have logged in as an Access user. And here you're going to have a link to allow you to log out of the application, but also a link to your profile. By clicking on that, you're going to be taken to your specific user profile. This is where you can see the email address that is associated with your account, and that's tied to your identity, so that's not able to be changed here. We also allow you the ability to change how your name is displayed inside the application from your profile and set up some additional security features, such as changing your password, setting up two-factor authentication, and seeing an audit events. To get back to the application, you'll click back to Access Hospice, or you could also choose to log out from the profile. Before we get into the rest of setup, we're going to take a quick tour of how to get around in the application. Most everything is tied to our main navigation bar that runs across the top of the application. The application has been divided into different functional areas that will help make sure that the people who are signed in are focused in on the workflow that matters most to their workday. The home menu is going to have a link for My Dashboard, and that will take you back here to the home page. Your pending co-signature, Quality Assurance Center, and HIS Export Manager, some sort of managerial tools here, are going to be found in the home menu, and of course we will have additional live training webinars on those areas. Your patients menu has everything that has to do with your patients, from your patient charts to the items that comprise that, as well as lists for your inquiries and referrals so you can keep all of your patients straight. Next, we have the scheduling section. This has both our patient and employee schedule, and we will be going into scheduling details at the end of our time together today. The IDG Center houses all things IDG inside the hospice application. This is been completely automated, except for the meeting itself. We can't have the conversation for you, but we have a lot of intuitive tools for IDG, and all of that is managed here under the IDG tab in the main navigation menu. The People menu is going to be where we house our People Center, and this is where you're going to manage your users that have been added to the application. The people that might be associated with your agency could be contracted employees, they could be salaried to full-time employees, they could be volunteers or students, and so all of those people are able to be managed here in the People Center, and we'll spend some time in there as part of agency setup as well. Billing houses all of the pages needed to complete your complete revenue cycle from a hospice perspective, from your NOE through your continuing claims all the way to your NOTR, as well as seeing the remittance advice for each of the claims that you submit across to your payers. At the bottom of the billing menu, if you have elected to sign up for Access's RCM solution as well as Access's DDE solution, you will see links to those applications under the billing menu as well. The Administrator tab is going to house our company setup information, and we'll get back to this in just a couple of minutes. Reports, of course, houses our Reports Center, which is a robust center for all of your reporting needs across the agency, from clinical to scheduling to survey reports to your billing and financial and employee-based reports. We also have links to our intuitive dashboards that we have built in the hospice solution. These dashboards give you a visual representation of 6 or 7 reports at a time so that you can take action on the things that are affecting your agency workflow from the dashboards. Last, we have our Help menu, which is a great place to go to learn information about the application. Our Help Center is constantly kept up to date with all the information you need to know about how to get through the application. If you have some questions, we have some great teaching tools in there that have screenshots as well as walkthroughs and step-by-step. So if you need a refresher on some of the training material that we go over, or you go over with your implementation consultant, the Help Center is a great place to go to get that information. We also have links to sign up for future live training webinars, as well as recordings of existing live training webinars. Our recent software updates is a great place to go to make sure that you always have the latest and greatest information. At Access, we are continually improving the hospice application, and as we make changes to the hospice application, we communicate those to you via messages from the messaging center, as well as manage them in recent software updates. It's a great place to go and check and see what's the latest and greatest tools that have been added to Access Hospice. Our Support Ticketing Center will allow you to communicate directly with the Access support team to report any issues or concerns you might have with the application. But this is also a place where you can request enhancements to the application so that we can continue to listen to you as our client and partner to how to improve the solution. And finally, we have a link to our COVID-19 Resource Center. I've talked already a little bit about our thought leadership and kind of being out on the front lines and paying attention to what's impacting your day-to-day workflow. The COVID-19 Resource Center is just one more example of that, and that is constantly kept up to date, so you have the latest information as to what's going on in real time. As we continue to move to the right, we have also built in a search feature inside the hospice application, and this actually allows you to type and search the software for the page that you're looking for. So if you can't remember from your training session where your list of physicians or insurances is, you can simply type that information in. And the software will prompt you as to where you might need to go to look for that information. Selecting that will take you to the page that you're looking for so that you can easily stay within your workflow for the day. The envelope is a link to our HIPAA-compliant messaging center. This allows you to communicate internally with anybody who is an active user inside of the hospice solution for Access. This is a great way to keep up your constant communication with your team, your coordination of care. And because this is behind the Access sign-in, all that information is fully compliant with HIPAA rules and regulations. So any information you might be communicating about patient information is kept safe behind the Access firewall. The last two items are our list and our add menus. This allows you to fully customize the hospice application to your agency's workflow and easily add new information to the application to make sure that the latest information is added to the solution. We will be spending quite a bit of time here inside the list and add menus as we go through agency setup. So the very first thing we're going to want to do when we're setting up our application is we're going to go to the admin tab and go to company setup. Company setup is where we house the information about your agency as well as the locations that are served. And this is where you start to get some information about your operational practices as well as payroll practices. When you sign into the company information, the very first thing you're going to want to check is to make sure that your vital company information has been entered correctly. This will be entered as part of your contract signing process. Our accounting team will make sure that this information that you have given to us on your contract gets here, but we would definitely encourage you to check and make sure that that information is correct. Things that you're going to want to highlight to make sure that you are correct is your tax ID number to make sure that that matches, as well as your NPI number, your Medicare provider number or your PTAN, and then finally your assigned provider submission ID or your FAC ID. If you are going to be generating HIS files to be uploaded to Medicare's KEYS system, the facility ID, the submission ID here, will automatically flow to that response file that you're giving to CMS if you have entered that there. So again, very important that you check tax ID, NPI, Medicare provider number, as well as your FAC ID. And then, of course, any other numbers that might be pertinent for your agency. Any locations that have been associated with your agency will be listed here. If you need to add additional locations, you can simply contact us here at Access, and we can get that additional location added as your business continues to grow. The next page in Company Setup is the Operations tab, and here you will get to select your agency's Medicare week. This is how you calculate your 7-day week as it relates to your patient practices. So things like visit frequencies falling within 1 week. You will let us know what Medicare week you're following. Of course, most common is the Sunday through Saturday model, but we do give you the flexibility to follow any 7-day window that your agency chooses to use. We do also allow you to update this information if you need to throughout your time inside the software. So if you are making an operational change to switch your Medicare weeks, you can plan for that in the future so that that transition is smooth and so that your staff is not going to get a whole bunch of alerts about frequencies that are out of compliance because you have made a change to your Medicare week. Finally, you will set up your company's payroll policy inside the solution. Here, you will get to set your company's mileage reimbursement rate and travel time reimbursement rate, the first day of the first pay period that you want to track in Access, and what your agency's payroll frequency is. You can select from weekly, biweekly, monthly, or semi-monthly. Based on your payroll frequency selected, you will then let us know what the last day of your pay cycles is going to be. In this case, if I switch from a semi-monthly payroll frequency to a bi-weekly payroll frequency, you can see this adjusts and is going to ask the last day of the pay period, and I'll be able to choose from the 7 days of the week. Meaning if I choose Wednesdays, on a biweekly payroll frequency, my payroll cycles will last for 2 weeks, ending on Wednesdays and beginning every other Thursday. In addition to your payroll policy, at the company level, you also get a chance to set any additional on-call rates that you might pay your employees for on-call tasks that they complete beyond their salary responsibilities. You can set a different rate for each visit that's available in the application, as well as a different rate for each payer that has been added to your agency. And we will discuss how to do that in just a moment as we continue through agency setup. Once this information has been added, you'll click Save, and that will save all of the changes that you made in the entire company setup process. The next thing I want to talk about is adding users to the application. By default, the person who signed the contract, who is the main contact at your agency, will have their user set up when your account is created. That user will then go through and add all of the additional users inside the agency. Your implementation specialist can help you navigate how to do that, but let's walk through the steps here as well. From the Add menu, we've selected to add a new user. And you can see here, we'll put in the user's information. This is their demographic data, things like their name, their address, their gender, date of birth. You can also put in their employee ID, an employee payroll ID, and their credentials and title that they're serving for your agency. If they work for only one branch at your agency, you can assign them to whatever branches have been added for your agency. Finally, you'll add their contact information, their phone number, and their email address. Remember again, the email address you enter here is going to be the user's identity inside the application. They will use the email address you put here along with their user set password in order to access the application. So you want to make sure that this is the email address you want them logging in with. If you have company emails and you want people using that, make sure that their company email address is entered here and not their personal email address. Finally, we have our system roles here where you can allow or restrict access on the weekends or before or after a specific time of day. Next, we're going to get to the Permissions tab. Everything inside Access is driven by the permissions set up for the user. This allows you to fully customize what your team members are able to do and see inside the application. So the permission portion of a user setup is incredibly important to make sure that they're able to do all the things they need to do for their day-to-day activities. User permissions are grouped into categories for administration, clinical, billing, and reports. Each main section has several different permissions you can give for each permission in that section. Things like view, add, edit, and delete. Sometimes these permissions change based on the category. However, you will be able to have a lot of flexibility when you're setting up each permission. For administrative users who are your administrators or leaders in your organization, you can turn on all permissions to view, add, edit, and delete for an entire section by clicking on the section title. You can also give full permissions for each permission in the list by selecting that permission. Finally, you can choose to give all view permissions, add or edit or delete permissions by selecting this category from the column heading here. Just as a word of warning, I would recommend limiting how many users you want to give delete permissions to make sure that people don't have the permission to go in and delete a whole bunch of information inside of the application. As you scroll down, like I mentioned before, some of the sections have additional permissions, such as reassigning and clinical, which has to do with a user's ability to reassign tasks on their schedule. Billing also has e-submission. We do allow the submission of claims directly from the hospice application for those people that have permission to hit that submit button. And then for reports, you have a view and an export permission. So you might have users in your agency that need to see information, but you don't necessarily want them downloading that report or emailing and sending it somewhere else. Next, you'll set up your user payroll. Your payroll type needs to be selected first, and based on the payroll type, will affect what payroll information is required to be entered for that employee. You can choose from salaried, hourly, or per visit pay types. When you select hourly, you'll select their base hourly rate and the effective date of this rate. And then you'll also choose which allowable reimbursements are allowed for that particular employee. Until a reimbursement type is turned on to be allowable, a user will not have these items pulled from their notes and put onto the payroll report. So for example, if this user is an hourly employee but does not receive extra pay for on-call, you would not choose the on-call reimbursement under the allowable reimbursements heading. There are directions throughout the user setup. By clicking on the blue dots, you can find out more information about a given section so that you have that information at your fingertips. Finally, on the rates table, you will be able to add specific rates that deviate from the user's base hourly pay. For example, if you wanted to pay a higher hourly wage for a clinician who is completing an initial comprehensive assessment, you could set a higher hourly rate for specific task types that can also be tied to specific payers as well if you want to adjust how much you want to pay your employees based on the payer source for the patient. Once you've made the selections, you will also have access to the user's infectious disease profile. This is a new feature inside of the hospice solution that allows you to do screenings for various infectious diseases, such as COVID-19. So if you need to screen your employees before they go out and see patients for specific disease types, you'll be able to document those screenings here, and they will be associated with that user's profile. So now that you have your company setup and your user setup complete, you're ready to move into the customization that comes in the list and the add menu. This is a critical step in agency setup because the information that you enter in your agency lists will drive the information that your clinical team can document as they go through the patient workflow. So until you, for example, have set up your list of physicians or insurances, you will not be able to select those as you enter patient referrals. So we're going to start at the top of the list here. We're going to skip inquiries and referrals and come back to that when we talk about the intake process. The physician list is going to show you a list of physicians that have been added for your agency. As you can see, Access automatically checks whether or not those physicians are PCOS verified, and we also perform an OIG exclusion check to make sure that that physician you're adding is not on the OIG exclusion list. To add a new physician, you click the Add Physician button, and you can enter all of their information into the form here. Pay special attention to the fields with a red asterisk, as those are required. However, you can also autofill the form using the physician's NPI number. This will take the information that's available in the NPI registry for the physician and auto-populate all that information on the physician form for you. The next item in the menu is your insurances and payers. By default, Access will set up a Medicare payer for you. Many patients we know in hospice are Medicare beneficiaries, and so we have set that Medicare payer up for you based on the location of your agency. We will assign that to the appropriate Medicare Administrative Contractor, or MAC, for you. You can, of course, edit the fee schedule for that Medicare payer to make sure that you have the most recent level of care reimbursement codes. And you can also add visit rates so that you can have the appropriate HCPCS codes and rates available for each of the different tasks that are completed inside the application. Once your payer setup is complete, all this information will flow automatically to the claims that are generated for the patient based on the payer type that is assigned to the patient. When adding a new payer, you will be able to add additional payers based on the payers you have contracts with at your agency. So if you have a Medicaid payer or commercial payer that you have a contract with, you will be able to set up the payment details, the fee schedule, as well as the payer details for each payer that you're contracted with. To add a new payer, you click the Add Insurance Payer button and input the payer information, the payer address information, as well as the fee schedule that's associated with that payer. The next item on our list of lists is users, and that's going to show you a list of all the users that have been added to the application, as well as the last time they logged into the application. Pharmacies are the next item, and here you will attach a list of pharmacies that you are contracted with that provide medications for your patients. So this could be a routine delivery pharmacy if you have an after hours or same-day delivery pharmacy, or as patients elect specific pharmacies that they're working with, you can add those pharmacies to the list here, and those can then be attached and associated with patient charts. Our custom medication feature is unique to the hospice solution here at Access, and this allows you to add custom medications that you might utilize in your agency that wouldn't necessarily be found in the drug database. So for example, in hospice, we use a lot of custom compound medications that aren't necessarily commercially available to meet the unique needs of a hospice patient who has maybe difficulty swallowing, or they have to take a higher concentration of a medication in order to achieve palliation of their symptoms. Access allows you to put those custom medications inside the list of medications for your agency, and then that becomes available inside the patient's medication profile so that you can be compliant with the medication management requirements that CMS has. Your list of DME and supplies will allow you to put your agency-specific DME and supply lists into the application. This again drives the type of DME and supplies which can be associated to a patient. This helps ensure that your staff is not ordering DME and supplies on a patient's plan of care that are outside of your contracted formulary rate with your DME and supply vendor. And this also allows you to track the cost that you are incurring and spending for each patient on their DME and supplies. Vendors are wide-ranging, as we know, in practice and hospice. This is going to be where you put all of the contracted and non-contracted vendors that you have a relationship with at your agency. So this can be things such as pharmacies. It could be short-stay acute care hospitals, assisted living facilities, skilled nursing facilities, funeral homes, or any other entity which you have a contractual relationship. When you go to add a vendor, you will put the vendor name and details about the vendor's location and contact information in, and you'll also associate a patient's vendor type. You'll see we also have an NPI field here, which is not always applicable. However, if you do specify a NPI for a skilled nursing facility, for example, that information can be flowed over to the patient's claim to make sure that you have all of the required information for facilities on your patient claims. Finally, we also allow you to attach your contracts inside the application. So you don't have to keep a file cabinet full of contracts in your business office manager's office anymore. You can do all of that contract management inside of the hospice solution. You can attach copies of the contracts, including their expiration date, so you can quickly and easily see which contracts are active and which are expired, so that this information can be available for your reference from a business perspective, but also should a surveyor request that information, you'll be able to give them a report with all of the contracted vendors on it. Next, we have document types. Document types allow you to sort all of the documents that you might be uploading to a patient or an employee file. This gives you complete control and flexibility to make sure that all of the information that's uploaded into the application can be easily found and sorted based on the type. There are default types that have been added to the application for you, which cannot be modified. However, you are able to create custom document types as well. Your list of adjustments here, again, comes with a list of defaults, but you can also add additional adjustment codes that you might need when you go to post payments and adjustments on your claims and on your remittance advice. Again, the default items cannot be edited, but we do allow you to add additional items to your adjustments list, and then this list can be searched when you're posting adjustments on your claims. Your custom templates allow you to put agency-specific templates into the system. So if you have documentation conventions that you have at your system, in your agency rather, you can document those inside the application so that staff isn't having to document the same information again and again. They can use the template feature throughout the patient's life cycle in order to make sure that they are documenting in line with your policies and procedures, and it will save them time from having to redocument the same information multiple times. You can see some examples that are here, but this is completely customizable so that it can be specific to your agency's policies and procedures. The last item on our list menu is the Teams. Teams is a unique feature inside of Access Hospice, and this allows you to organize your staff as well as your patients into care teams so that you can keep track of who is responsible for seeing those patients. This is also a filterable option on all of our reports, so you can break down reporting data not only based on a patient, on a branch, but also on the team level, so that gives you a lot of control and flexibility to understand how things are going from a team perspective. When you're adding a new team, you'll be able to specify the team details and set the team's IDG meeting schedule. This will kick off all the automation that is needed for running and managing your interdisciplinary group meetings at the agency, and this can, of course, be edited and updated at any time. You will then finally associate different users to the team as well. So a group of nurses, a social worker, a chaplain, or a physician who are members of the team will be able to be associated so that they can be in attendance for the meetings for the team which they're associated to. Teams can also be split into groups. So as your teams continue to grow, you can have groups specified as well. The last thing I want to mention about teams is that a care team is something that is required as we go through the intake process. So you'll need to make sure that you have gone through to set up at least a few items in the list menu as you're getting started with agency setup to make sure that you'll be able to proceed through intake and get patients added into the system. At this point, I'm going to pause quickly and just check the chat box here and see if there's any questions that have come up so far with agency setup. Or if anybody has any questions, you can feel free to come off of mute and ask those at this point. Okay. I'm not seeing any questions there, so we will continue to move on. The next item on our agenda, now that we have our agency set up and our lists populated, we can go ahead and start adding patients to the application. You have a couple of ways that you can get patients added to the application. You can do this from either the inquiry or from the referral. Patients can also be added from the inquiry list or the referral list, which can be accessed here in the list menu where we've been spending a lot of time. You can directly add an inquiry or a referral from the add menu, or you can navigate through the patients menu, which will take you again to the inquiry list or to the referral. I'm going to choose to use the add menu, and we're going to start with an inquiry. Inquiries in the hospice application are soft leads. These are patients that are curious about hospice. They might need some additional information. However, they're not ready to be a full referral yet, or you don't have all the information you need to make them a full referral. Ultimately, you can use this if you have a lot of referrals that come in at the same time, because this is very simple to get patients into the system. There are only 4 required fields that you see here in the inquiry. They are the patient's first and last name, the patient's phone number, and the associated branch. Once those 4 items are added, this inquiry can be saved to the inquiry list. You can move on to the next patient that has been referred and get started adding your next patient. At the bottom, you see you can add the inquiry, which will add them to the inquiry list. You can save your changes and add another inquiry, so you can get through this very quickly, or you can take the information and you can convert that patient to a referral. When adding a referral, obviously a bit more information is required. If you have selected to convert your inquiry to a referral, any information that you documented on the inquiry form will flow automatically to the referral form. If you're choosing to start directly from a fresh referral form, of course, you'll need to fill in all the required information that is indicated again by the red asterisks throughout the application. So we'll go through and fill some of this information out so you can see how this works. A referral source here is going to help you track and see where your patient referrals are coming from. If they're coming from a specific physician, from a specific facility, from an internal referral source, or an other referral source. This will allow you to run reporting data to see where your patients are coming from and make strategic decisions about where you want to focus your marketing efforts in the future. When adding a physician, again, this is going to pull from the list of physicians that have been added to your agency. If there is a physician that has not yet been added, you can simply click the link to add a physician, and a new tab will open so you can add a new physician without having to navigate away from the referral. Demographic information is fairly self-explanatory, but I do want to highlight the green shading that you see here, as well as the locator badges. This information is being collected already at intake for HIS. We know that this information is required and that you have to send it, but we have a belief at Access that we only want our clients to have to document information one time. It's a horrible waste of time to have to redocument information that's already tracked in the application. So once you enter it one time, that information flows throughout the patient's life cycle in order to maintain the integrity of your information and to prevent fatigue from having to redocument information. Again, any field that is indicated with a red asterisk means that that field is going to be required in order to save your referral. As you scroll down, you can add a patient's primary address. If they live in a facility and that facility has been added to your vendor list, you can start typing that facility's name. So for example, I have a hospital system that I have added already for this agency. I'll click on that, and that's going to flow all this information over here directly from that facility contact card to make sure that I have a very easy way to enter that information. If the patient has a separate visit address from their primary address, you can set a customized address. We are integrated fully with Google Maps. So as you start typing the address that the patient has, you'll be able to select that, and we will pull forward the city, state, zip code, as well as the county for the address from Google. So as you're used to typing and searching for those addresses, we do that. And again, it just saves you some additional valuable time as you're going through and adding the patient's referral information. Our payer information section here, of course, allows you to document the patient's payer information. At Access, we are contracted with Medicare as a network service vendor, which means that we can submit claims directly to Medicare as our own clearinghouse, but that also gives us the opportunity to perform Medicare eligibility checks right inside the referral. So you don't have to leave Access to find out your patient's Medicare eligibility data, as well as the eligibility data for any other payer. That information will be displayed here for you so you can make decisions based on the patient's eligibility information. Your primary payer will also be added for the user. When you add your payer, you'll be able to select payers that have been added. So again, very important that you go through the agency setup process that we discussed. So you can search those payer types that have been added for your agency and select the effective date for the patient, what payer type the this payer is for the patient, whether primary, secondary, tertiary, or a room and board payer, and then what their Medicare Part A effective date is, of course, when you select the Medicare payer type. Once you have added that payer, they will be visible here. And if the patient's payer status changes over the course of their stay, perhaps they become Medicare eligible or they become Medicaid eligible, and you need to add or adjust the priority of their payers, you can do that at any time from the patient's chart. Admission information is collected as well based on the type of information as well as the admission source. This information can of course be updated as the patient gets closer to admission, but this information is required to go on your claims, and we will flow that information there for you automatically, which is why we require it at the admission information section. You'll then also put the patient's benefit period number that they are being admitted into, and the application, once the patient is admitted, will automatically calculate the patient's benefit period dates for you. Your authorized contacts are going to be the contacts for the patient. You can add up to 10 contacts at the point of referral, and you'll specify the role and relationship each contact plays for the patient, as well as if they're going to serve as the patient's emergency contact, if they're the primary bereaved, as well as if they are the person who will be receiving the CAHPS survey. Clinical information allows you to document the diagnosis, physician, and care team information about your patient. You can enter the referral diagnoses as well as any other diagnoses that you've received on your referral documents. And in Access, we allow you to search either by the diagnosis code, if you happen to know it, such as this I-10 for hypertension, or you could also search the database by the description, which is more likely as we don't all have the ICD-10 code manual memorized. Finally, we have a documents section where you can attach all of your referral documents that you receive for your patient and get that information to the patient's chart, which is then available to every user of the application throughout the patient's admission inside the hospice application. We allow you to put various different document types here as well. When you click on Add Documents, this will open up the files on your machine. You will select the document that you wish to upload. You can choose to rename that. And then you'll select the type of document that this is. So you can see here we do allow you to upload various types of documents to the patient's chart, but having this sorted by type will make sure that you have the information that you need readily available. When you save the document, that will be attached here to your referral, and that is available to anybody who has access to see the referral. And once the patient's chart is created, that information flows automatically over to the patient chart as well. Finally, we have a referral readiness tool. This does not stop or force your workflow in any way, but it is a decision support tool to help you make sure that you have all the documentation you need for a complete hospice referral. At this point, you're ready to make a decision on whether or not this patient is ready to be admitted. If they are ready to be admitted, you can simply click to convert to pending, and all the information that has been created in the referral form will be used to generate a patient's chart for you automatically. If you're not yet ready, you'll click Create Referral, and that information will be saved to the agency's referral list. There are validations as well to make sure that all of the required information that you need is been completed for the patient. If you've missed some information, that will highlight in red for you and indicate what information needs to be added in order for you to be able to save the referral. Lastly, once you click that Convert to Pending, you will be taken to the patient's chart, which will be created for you. Your patient will be in pending status inside the application, and we're going to take a look at a pre-populated patient that I have completed already, Mr. James Atwood. When converting to pending, you are required to put some additional information in to make sure that the patient's chart has been created successfully. This information includes the patient's ID or their medical record number. All this information that was added in the referral does flow here. You'll also need to add their primary language and the anticipated service location for the patient. In this case, the anticipated service location is home. And you see, we will also keep track of any other locations that the patient needs to go to during their course of care. And those locations have the associated Q codes available with them as well. Clicking next, you'll be taken to the next page, which is your payer information section. Again, all the information that we documented as part of the patient's referral has been saved and pulled over here. You just simply review it and make sure that it remains up to date. Next is the clinical information tab. Again, all the information that you documented will come forward here, but at this point, we require you to select a care team. You'll choose the clinical manager for the associated care team and the nurse who is going to be completing the admission. Again, diagnoses will have flowed from your referral form here, and then the additional diagnoses can be added at this point. The Physicians tab will be where you indicate who is going to be serving as the patient's hospice and attending physician. If the hospice physician is also serving as the attending physician, check this box, and it will automatically populate the attending physician information based on the hospice physician information entered. You have the opportunity to select the patient's pharmacy, their needed DME, as well as supplies at this point. You'll notice these fields are not required to be entered in order to get the patient admitted, but if this information is known at the time of intake, it can be added to the patient's chart, and this information is stored here so that every member of the interdisciplinary team can see the information that has been added to the chart. Next, the authorized contacts which have been added during the referral will flow here. Any additional contacts can be added, and this information can, of course, be updated as needed. Again, you can add up to 10 authorized contacts for each patient. To add an additional contact, of course, you'll click this button and then enter the second contact detail information. You can adjust the priority of your contacts or remove contacts altogether from the patient's chart as needed. Next is our emergency preparedness section of the patient's chart. Here you'll identify a patient's emergency triage level based on the levels that have been added to the application, as well as the patient's additional emergency preparedness information. If they need assistance during an emergency, if you need to contact your local authorities, or if they need specific supplies, those can be added. Additional emergency preparedness information can also be added here. So if you have specific items that you need as your agency policies and procedures, you can utilize the custom template feature, which will allow you to put that information into the patient's record. Additionally, you can document their evacuation plan if that is a necessary component of that patient's emergency preparedness plan. Next, you'll have an opportunity to document about any advance directives that are known at the time of intake. If you have copies of those documents, you can select yes, and then you'll be able to specify which advance directives have been added and obtained for the patient. And additionally, you can document about their treatment preferences as you have those goals of care conversation with your patients during the intake process. A lot of times there are question fatigue experienced by patients and caregivers surrounding their hospice admission because they get asked those same treatment preference questions multiple times by multiple members of the team. So having this documented in the patient's chart will prevent that from happening for your patients and their families. Lastly, we have the funeral home information. So we know that that's an important part of the intake process, is starting that conversation. If a funeral home is known at the time of intake, this is an option to be added here as well. And you can also autofill the funeral home if you have added the funeral home to the agency's vendor list. Last is the referral information section. This will, again, populate based on the information that was documented on the referral form. There should be no additional information that is needed on this form. However, you can check that information to make sure it's correct before saving your patient chart. Once that's done, your patient chart will have been created and you're ready to go ahead and begin scheduling. So scheduling is the last piece of the training webinar that we have planned for the day today. There are several ways to access the patient's schedule, the employee schedule. So we're going to go over all of those and how you go about creating items on the schedule. In the schedule menu, we have two options for you. The first is the patient schedule, and the second is the employee schedule. If you choose the patient schedule, of course, this is going to be patient specific. It will show you all of the tasks that have been assigned for every discipline for a specific patient. So if you take funny accession, for example, you'll be able to see all of the disciplines that are scheduled to see that patient, as well as the ordered disciplines who are assigned for the patient. If you choose the employee schedule, you'll see all the tasks that are associated for a given employee. You'll see here on the calendar that this particular user, Matt Abbott, is assigned to see just one patient at various points throughout the next 2 weeks. As you navigate to different users or different patients, of course, you will see their schedules populate based on the things that have been completed already on their schedule. From the patient's chart, you can also access a patient's schedule through a direct link, which is called View Patient Schedule. Right on their main chart page, you can click that, and that's going to take you to the patient schedule for that particular patient. The last place you can access your schedule from an employee perspective is from My Dashboard. Again, as I mentioned at the beginning of our time together, My Dashboard is customized for you. Today's tasks is going to show you all of the things that you have been assigned inside the application. So you can see I have quite a few items that are on my schedule to complete for the day today for a variety of patients. If I choose to view all tasks, that's going to take me directly to my employee calendar, and then I will be able to see a calendar view of all of the tasks that I've been assigned for the next 2 weeks. For the purposes of the rest of this, I do want to operate off of the patient schedule. So I'm going to navigate there quickly from the schedule menu. Here, again, you can see we have a calendar view of all of the scheduled tasks that are available for a particular patient for every discipline. So you can see I have a dietary counselor assessment, I have a social work visit, a spiritual counselor visit, hospice aid and skilled nursing visits, all scheduled for this patient. Now on my calendar view, I can see 2 weeks at a time by default, or I could widen this out a little bit and I could see the entire month for this particular patient. So you can see we have quite a few people going to see this patient on the last day of the month here, trying to get some of those visits in. So those are there. In addition to seeing the schedule as a calendar, you can also see the schedule as a list. The list view gives you the 14-day and 1-month view options, but you can also see all of the tasks in the patient's entire benefit period as well. This will give you the task title, the status of the task, the date that the task is assigned for, and who is assigned to complete the task, as well as a few actions over here. For already scheduled tasks, you can reassign those to a different user on an individual basis. You can choose to print or download the specific task, or you can delete the tasks. And again, this is all tied to your user's permissions, what you are able to do and see inside the application. Clicking on the assigned to username will take you to that user's profile. And clicking on the task title is going to open the task so that you can begin documenting. To add new tasks to the patient's schedule, you'll click the Add Task button. And this will allow you to add a variety of tasks from the task list and assign those to a given employee on a specific date. Tasks in the hospice application can be added as shifts as well. So if you have an inpatient facility or you're staffing for continuous care shifts, you can create a task that is associated with that shift. You would enter, in that case, how long the shift is going to last and when the shift starts. Every task added to the schedule can also be added as an on-call visit. We know in hospice care a lot of action happens overnight for our patients as well, not just during regular business hours. So any task that is available in the schedule center can be added as an on-call task. So you could do an on-call admission, an on-call death visit, or on-call PRN visits, or even on-call care coordination, coordinating phone calls between your triage nurse and various members of the interdisciplinary team as needed. Each and every task can be associated and indicated as an on-call task. We do also give you several other options to create tasks to an employee or patient schedule in bulk. So let's say, for example, I see I have a skilled nurse discipline here for this patient. I'm going to choose my skilled nurse visits and assign that to a particular employee on my team. And I want to schedule out their entire certification period. From the repeat dropdown, I'm going to choose the flexible option. You see, you also have options to repeat these tasks on a weekly, bi-weekly, and monthly basis as well. I'm going to choose flexible though, because this gives me the most flexibility in order to select the date that I need. I can see here my current benefit period for this patient lasts from March 8th until June 5th. So starting on March 8th, I can plot out my patient visits for skilled nursing. I will choose the dates on the calendar that I want based on my discipline frequency so that I can schedule things in bulk. Inside the hospice application, we also show you any tasks that you are scheduling that are outside the ordered discipline frequency. If those tasks are outside the frequency, you can remove them from your list, and this frequency tracker will update as you remove those tasks from the scheduling process. Anything that falls within the discipline frequency will receive a green check mark, and you will be able to see the discipline that it is associated to. Access does not allow you to schedule tasks outside of the patient's benefit period. For assigned tasks, you can also reassign those tasks. We know that from time to time, our patients' schedules change, so we have a couple of ways that you can do that. First, you can reassign each individual task if you want by clicking the Reassign button. This will allow you to change who the task is assigned to so that you can adjust who is going to go out and see that patient. We also understand that sometimes you have offered your employees some time off, or you need to add a new nurse to the team or reassign patients from one nurse to another, and you'd like to do that action in bulk. You can do a bulk update of the patient's schedule as well. Any task that has not yet been started or is not yet due can be updated in bulk. Here you can update the start date, add or edit any shift details that are needed, as well as reassign that task to a different user. Any changes that you make here will be saved once you complete the bulk update. Lastly, sometimes all you need to do is adjust the day in which you're going to see a patient. From the calendar view of the schedule, we give you the ability to simply drag and drop to reschedule the date of a particular visit. This functionality is, of course, available on both the patient as well as the employee-based schedules. At this point, I'm going to pause and double check for any other questions, but this concludes the information for intake, scheduling, as well as agency setup. So I want to thank everybody for their attendance today. I'm not seeing any questions here. Again, as you ruminate on this information, of course, under the Help menu is a great place to access our Help Center to review any of the information. And a recording of this session will be made available on our website as well. Thank you very much for your time today, and we'll look forward to talking to you again soon.
Thank you for joining our on-demand training today. Access is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading Help Center or at access.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Access. Empowering care anytime, anywhere.